Hi, I'm Dr. Trevor Haynes with Elite Foot and Ankle Associates, and I'm here to talk to you today a little bit about plantar fasciitis. Now, plantar fasciitis is a pain that occurs right here in the bottom of your heel, mostly towards the inside of your heel, that can be very painful when you wake up and first step out of bed in the morning. It's also painful after periods of rest and can be painful late in the day after being on your feet for long periods of time. Now, plantar fasciitis is not a specific injury per se. It's rather an overuse injury, something that occurs over time. And what happens is you have a ligament that runs from right here on the heel up towards the ball of the foot. And over time, that ligament, or that what we call that fascia, can become very inflamed, mostly here at the heel. So as that gets more inflamed, it's more painful when you walk on it. When you get walking, it typically will warm up. That's when the pain somewhat goes away until you rest again, and that band will contract. And then when you get up and take some more steps, it becomes painful again. Plantar fasciitis is a very common pathology. However, it can be very painful. Here at Elite Foot and Ankle Associates, we can treat that in a myriad of ways. Typically, we start out with a steroid injection in the more acute types of plantar fasciitis due to the component of the pain being mostly inflammatory. We also encourage icing and some stretching. We also offer shockwave therapy here, which is a great treatment for plantar fasciitis. It's very easy to do. It takes about 5 minutes for the treatment. It does not require anesthesia, and it is non-painful, meaning you can get up and walk right after the treatment. Treatments are typically once a week for about 3 to 5 weeks and can typically resolve the pain associated with plantar fasciitis. When we get to more chronic plantar fasciitis, a little bit, sometimes some more extreme measures have to happen, such as surgery for the plantar fasciitis. However, that is not very common. You also may hear about heel spurs. When this ligament becomes inflamed, or this fascia becomes inflamed, it pulls on the attachment here at the heel bone, which can sometimes form a little remodeling at the bone, creating this spike or this spur at the bottom of the heel. We used to talk about, having our heel spurs removed. However, studies nowadays have shown that less than about 5% of these heel spurs are typically painful. So, we'll get x-rays here at our office, we'll evaluate your heel, we'll evaluate your pain, and we'll establish the best protocol for your heel pain. If you're suffering from plantar fasciitis, whether it's been acute and newer onset plantar fasciitis or chronic, come see us, we'll get it taken care of, and we'll get you back on your feet. Thank you.